I'm an old public health nurse too, so I'm very beauty focused or whatever. And I was looking for things that we could do through our church health that would really have an impact, not just for my congregation, but for people out there that are struggling. And I see what Richard's been through and what we've been through with trying to manage this diabetes. But there's newer meds, there's newer tricks out there, there's newer science out there that we really needed to capture. And I just wanted to, whoever was interested could participate. But I said to Rich, I'm like, let's do this. Maybe we can find something that'll work for us.
She says, you should go. And so I said, well, yeah, because it was going up and I need to do something. I just didn't know what. And then we try to get the freestyle. And so I said, well, so it was working. We were, watching our eating habits. We were losing the weight every week. You could see it dropping down, but still it was just, my sugar still wasn't coming down. Probably, the eating part, the dietary, trying to set up what, 4 food groups, what you want to eat and what you can have, but in smaller portions, how to gauge yourself. And I think that's what helped a lot.
And I think it's important too, because you hear this with healthcare providers. They tell you can't eat this, you can't eat that. I never say that to people. I will never tell somebody they can't have something. But there's a way that you can plan to have something and not have a big impact on your blood sugar. I mean, you can smaller portions or the timing of it or give up one thing. As soon as you tell somebody they can't have it, then they start craving it. So you've got to learn to work around that and kind of build it into their diet or plan ahead.
I think you're both great. Because Juliana was pregnant and she had
she had pregnancy-induced diabetes.
Yeah, so she was on the same thing. So we understood what she was going through now, because she had it. But she was great. I mean, she answered our questions. She did a great class,
And the guest speakers she had coming in for nutrition and whatnot, I can't remember all their names, but they all did really good classes. They were really patient with us in the group. And I think our group really had quite a camaraderie with each other. I think you saw more camaraderie with the people, and they'd meet during, or before or after worship and kind of compare their, not that they're competitive, but just compare their journey with what's going on during the week. It's really kind of funny. Although they might say, well, what's your blood sugar this week, kind of thing. It just sets up that camaraderie. I think the other important piece of the program now, the focus were the people experiencing diabetes, but like one gentleman, his wife was coming with him, which was good. I mean, I think the spouses, if you have spouses, they should be there for support. But she was also just diagnosed with her A1C was going up. So she was, a few weeks into the class. But she was using that information now, and I was working with her to take that information and apply it to her situation. And her A1C is back down to normal now. So that was the same fellow that had like the neuropathy. And then and their daughter, just before the classes start, she had an elevated A1C, was diagnosed, and she's doing a better job with it. So she's had a positive impact. So that was a family that was impacted by this class. That was, and we still talk back and forth. I mean, so that was really, I think that camaraderie and knowing that you're not going through this alone. It's okay if you misstep. You can always, you just say, all right, start over, just let it go and start over. Get rid of the guilt, get rid of the, that negative stuff, and just do the best you can and learn from what you're doing. So having some time to reflect.
But I think if everybody just goes to this class with an open mind and, don't go in there and say, this is not going to work, but go in there and say, well, yeah, I'll try this. And once you see it's not hard, just changing your habits a little bit, get a little more exercise. 'Cause I think a lot of people start seeing that, they get out walking more, working in the gardens instead of sitting on the couch, so and a couple of the older couples there said that's what they do, a lot of yard work now. They get out there. I mean, they really can't walk as far, but they do a little bit of walking, but they like working outside. So they've been doing that now.
I teach the Faith Community Nurses Foundations course. And last May, we had a retreat course. We were at a retreat setting, and it was a 36-hour course, training nurses to be parish nurses. And I invited Juliana to join us on Zoom. And so she did the presentation. And I think, and one of the parish nurses from AU has a congregation in Anderson also. She's working with the Hispanic population. I think they were part of the program as well. And so we started spreading that out through I had Juliana come on and talk to our South Carolina Faith Community Nurses Association and talking about this resource. I think this is a dynamite program for a church health ministry because you're working within your congregational members. You do your congregational assessment. You can identify who's at risk. But you open it up to the community to come in. You could really have a pivotal piece in all that. Because, healthcare is mind, body, spirit. I mean, you got to have those components in there. So it's a good way to support. I'll get off my soapbox.
I say come with an open mind and kind of, take in a lot of information. And you can, like I said, open mind, come in, try it, listen to what they're telling you, eat right for a couple of weeks and see what happens. And you'll watch your numbers go down. And once you get into that habit, says, I can do this. I think that is, and like I said, Juliana was great at it. She just had the right attitude. And, they weren't yelling at you like you can't do this, you can't do this, but they kind of, with the booklet they gave us, you kind of, what you can, what you can't do. But I think people go with open mind, it'll work for them.
And I think the class gives you a lot of information, but having that week to digest it and come back and do that discussion group and say, well, how did it go this week? Learning how to make goals for yourself and how you're achieving those goals, I think are really important, but doing it when you've got people that support you and not criticize.